Welcome to another segment of our Partner Spotlight series, brought to you by the members of the Regional Chronic Disease Collaborative. The Regional Chronic Disease Collaborative members work together, combining their resources and expertise to help prevent the development and progression of chronic disease across our region. Our Partner Spotlight initiative is to help share innovative approaches being used throughout our region to improve population health. Welcome, everyone. I'd like to introduce Jackie Kelley, who is an outpatient case manager with Benefis Health in Great Falls, Montana. She's here today to share a little bit about their remote patient monitoring program. Welcome, Jackie. How are you?
I'm doing well. Thank you.
Great. To start out with, why don't you share a little bit, just do an overview of your remote patient monitoring program and what the goals of that program are?
Okay. So I follow patients through family medicine, internal medicine, and OB office. The primary care provider or the specialty office then refers to me for patients that have blood pressure concerns. They may already be on a blood pressure medication with still having elevated blood pressure readings. They may have low blood pressure readings or just be symptomatic altogether. We have added in the gestational hypertension program, and that's following ladies that are pregnant and are having high blood pressure, or they have some other risk factors that the provider wants them to join the program. They send referrals to me through our EHR system. I contact the patient, get them set up with the program, and then we move forward from there. The ultimate goal of the program is for patients to have a better understanding of their blood pressure, a better control of the blood pressure and their symptoms, and improving overall health for them.
Great. And my understanding is you are working on the hypertension or the blood pressure remote patient monitoring program, but the functionality that you're using really can capture more data points than that. Can you share a little bit about what else is available for you to monitor?
Yeah, we have the capability of monitoring, pretty much, the blood pressure, heart rate, their weight, their oxygen levels, blood sugars. So depending upon what the doctor wants them followed for, we have the capability of adding that device in for them to monitor and see those readings.
Right. And I know you guys have been doing this for a long time at Benefis, about 4 years. And when you initially set up your program, you were using a third-party software program. And my understanding is now you implemented Epic as your EHR, and you are managing this program now through Epic, and you're using the patient portal, and it's called MyChart with Epic. You're using that to communicate with the patients and also collect data. Is that correct?
Yes, correct. Yeah.
All right. Sure. So what data all are you tracking currently?
Right now, for myself and my specific position, I'm basically the blood pressures, the heart rate. I do have some patients that I'm also following for blood sugars. So, yeah.
And you recruit patients. You talked about this a little bit, that most of your patients are being recruited through provider referrals. Is that correct?
Yes. It is specific, to Benefis. They do have to have a primary care provider or a specialty provider that is with Benefis to be part of this program. There is no charge for this program. And through the program, if the patient does not have a blood pressure monitor themselves, we do have loaner devices that we're able to check out to them.
Great. Yeah. So once you identify, and I know you've been doing this program for a while, so initially when you set up the program, you did look at a lot of data to identify patients and did a lot of recruitment. But at this point, your program is pretty mature and most of the recruitment is coming through and you don't really have any trouble identifying patients who need this program. Is that fair to say?
Yeah, the providers now that we have on board are familiar with it. We do have new providers that are starting, and then once they are familiar with it or are told about the program, that they find it beneficial. And so then they now then are on board and referring patients to follow. Yeah, so
Great.
keeps it pretty busy. Yeah.
That's great. So describe, once you recruit a patient to be part of a remote patient monitoring program, describe the process. Like you just got a referral. What happens next?
So the provider sends me a message or a referral through our AHR system. I then contact that patient. I'll call them, introduce myself, let them know that their provider has referred them to the program. And I always let them know there's no charge for it. I verify if they have their own device or if they need a loaner program monitor, excuse me. If they do, then I make arrangements for them to come into my office so that I can check that monitor out to them, make sure they know how to use the device. So I go over the proper technique to use when they're monitoring their blood pressure at home. And then once they understand that, we have options of, so either they're going to use our, the portal through Epic, the MyChart, and they'll download that on their phone or their home computer and take their vitals and enter it into that daily. And I see those daily. The provider then has access to that also. Or if the patient may not be comfortable with that technology, don't have a smartphone to use or don't have access to a computer. So I make arrangements to call them weekly. They keep a written log at home. I call them. They read those readings off to me. Then I document that and forward that information on to the provider for their advisement.
Right. So it sounds like you have a solution, even if people may not be comfortable with technology or have reliable internet access, and they can still participate in your program.
Yes. Yeah.
Great.
Yeah.
And then how long do people usually, if you loan out a blood pressure cuff, how long do they usually keep those blood pressure cuffs?
So average for patients is 4 to 6 weeks. Ultimately, it is up to the provider because if they're not on a blood pressure medication and they start, or if there's an increase or decrease in medication, the provider usually likes to follow them additionally, on the average about 2 more weeks, just to make sure that they're not having any side effects. The blood pressures are staying within a stable range and they're feeling better and they see that improvement. So that's average. Now with the OB patients, they are followed throughout their pregnancy and then they deliver. And then usually 4 to 6 weeks after they deliver, they continue to monitor until they see the provider for that post-delivery follow-up. I have had patients that are from OB that may have to be on blood pressure medication. So it may be just a little bit longer after that. But that's kind of like the average there.
Great.
Yeah.
And you said you were getting daily information, or they're just tracking it daily? How often are you getting data from your patients?
I request that they take their blood pressure daily, at least once a day. I let them know that it's not rigid. It's not meant to cause them stress and be so rigid that, it's like, oh, I forgot this day. It's like, okay, then just the next day, go on. It's a tool for them and their providers to see how they're doing at home. We find that people that are in the comfort of their home, blood pressures may be less than what they are in the office, coming in and seeing their provider. There's more stress, anxiety about that. And blood pressures may go up. So that it's a tool that they use to see what they are getting at home. So I do have some providers that request that they take it in the morning and then in the afternoon or evening. to kind of see that fluctuation because it does fluctuate throughout the day. So, but usually once a day. With the OB patients that are on it longer, or even individuals, um, they once they kind of stabilize and the provider kind of gets an idea, they may say, okay, let's start with 2 to 3 readings per week thereafter, and then once they are more stabilized, then the provider determines the length that they have to be on it and when they can be discharged.
Okay, great. And it sounds like either the patient is entering their data into the portal, or you're getting their information and entering it into Epic. So how are the providers using that patient generated data?
So they will review, like I call the patient weekly or message them weekly through our Epic system to follow up with them. And just usually I check with them, overall, how are you doing? Are you having symptoms to report? Any adverse concerns? I then document that information, forward that on to the provider. They review that. They're able to review that week's blood pressures, or, some patients I follow more closely. It may be, I'm checking with them twice a week, um, depending upon the need there. They review that. They determine whether they need to increase, decrease, or even add a medication. So they're using that as a tool then to better advise the patient on their needs.
So another way I think you're using that patient data, based on previous conversations I've had with you, is that Benefis currently has chronic care managers, and they're managing a handful of patients through the chronic care management services. Is the work that you're doing and the data that the patients are receiving, is that also contributing to that program?
Yes, I also do chronic care management program, and I have one provider that I work under for that program. So I may have some of those patients on chronic care management program that I also follow for vitals, whether it be blood sugars, for they have diabetes, blood pressure. Some of them, depending upon the need, it may be weight at one point because they've had increase in lower leg swelling or things like that. So it determines the need of the patient, but we do that. Use the chronic care management program also for remote patient monitoring. So
great. And what health outcomes have you seen with this program?
Both benefit to the patient and the provider. The patient has a better understanding of their health condition, what they can do to continually improve, whether it be diet, cutting out sodium, watching that, the fluid intake, exercise, monitoring their vitals so they know it's like, okay, this is where the provider feels is within normal limits or range where they want me to be, knowing symptoms to watch for, to report to the provider if they have those. And then on the provider side, just having that ability to have access to that information or symptoms sooner so they can act on them sooner helps prevent the patient from, going to the walk-in or ending up in the emergency room, and then, maybe preventing admit for those symptoms or concerns. So it's a benefit all around for all of them.
And in your EHR, are you able to set up alerts so that if patient data comes in and it's out of range or it needs immediate action, is there an alert system that notifies you or the provider?
Yeah, and that works out nicely because if they're using the Epic portal portion of it, the app, and entering in their vitals through that, if it's out of range, they get a pop-up and it will trigger them to answer a few questions on symptoms. Are you having this? Are you this? questions for them.
Mhm.
Depending upon, how they answer, it'll trigger another question for them. And then also it does say, please take your vital and another, 1 to 2 minutes to check the accuracy of it. So then that reading, then they'll enter that in also. So we can, check that accuracy, and, where they're at. So it does trigger, myself and the provider. If they're out of range, it's flagged for us to see that alert that it's out of range,
Mhm.
and we can follow up accordingly.
Yeah. And that provides that opportunity to proactively address it before it exacerbates and becomes worse.
Yes. Yeah.
Yeah. Great. So Benefis has had this program for a while. What changes have you seen in the program over the last 4 years?
Well, initially, we recruited patients based on risk factors, excuse me, and then it has grown. We've added different departments. I initially would write everything down. Then we went to our third party recording way. And now, since we are on one system, the Epic has kind of streamlined it a little bit more with the patient portal part of it, having everything in one place for the patient, the provider, and myself to see and interact that way. So it's
Yeah.
kind of progressively grown.
So it sounds like you guys have learned as you've gone through the program and adjusted it where you could. Is there any other future plans for the program that you know about?
Well, we are working on trying to, and everything is evolving, and we come upon things. So it has the capability of being Bluetooth compatible, and we have some of the devices that I loan out that are Bluetooth compatible. But then it does put then another step on the patient to when they download either the portal part of it or have it on the My Chart on their home computer, that then they have to sync that device to their system in order to record. So that's a work in progress. That's a goal that we have, and we're working on that. But like I said, it's ongoing process, but we have the capability of adding that on. Yeah.
Great. And what part of this program has made you the most proud?
I just think hearing from patients, how this has helped improve their overall health, have a better understanding of goals and where their vitals should be at, symptoms to watch for. They're just grateful they're feeling better, so they have a better understanding in that. They have appreciated the more one-on-one assistance that they have had with the program. They just have a better understanding, and it's just nice to hear. You see them either in person or on phone, but you can just hear it or see it on their face that they are very appreciative and have a better understanding of their overall health needs and goals. Yeah.
Great. And what lessons or advice would you have for other facilities who would be either interested in starting a remote patient monitoring program or expanding their program?
I think what I feel is important is just meeting the patient where they're at. It may take a little bit more work on your part to do that, but overall, it's important still to put the patient first and meet them where they're at, and you can just establish the same goals that you're working towards for everyone. So
Great.
yeah.
Great. Anything else you'd like to add?
I don't think so. Good luck to everyone out there. And I just think that this program has been beneficial for patients and providers. So I've enjoyed working with the program.
Great. Thanks so much. Thank you so much for taking the time today and sharing your information on your remote patient monitoring program.
Oh, you're welcome. And thank you.
You bet. Take care.
You also. Thanks.
If you are interested in sharing your innovative approach, please contact one of these Mountain Pacific representatives. Thank you so much.